Welcome to Med-Surg Mini number 4, where we're going to be talking about gout. Gout is a disease that occurs from diminished excretion of uric acid by the kidneys. This leads to hyperuricemia, and then that causes monosodium urate crystals to develop and deposit in the joints, bones, and soft tissues. This crystal development causes inflammation and pain in that area. It typically resolves in a couple of days to weeks. However, people that experience gout often have relapses. Each relapse can be more severe, last a little bit longer, and cause more pain. Frequent experience of gout can lead to chronic arthritis as well. Risk factors for developing gout include being obese, having hypertension, having frequent meat, alcohol, and seafood consumption, and frequent use of thiazide diuretics like hydrochlorothiazide. Management of gout is first we need to assess and confirm that it is gout. So from the assessment point, we would see swelling of the joints as well as warmth and redness around that joint, intense pain, both to touch as well as with movement, and impaired joint mobility. The diagnosis is based off of analyzing the symptoms, and then we can do laboratory testing and indicate that the individual has high uric acid levels in the blood. From a radiology standpoint, we can see joint erosion as well as soft tissue nodules that form. Complications of gout is that individuals that are experiencing gout because of the higher level of uric acid may also be more likely to develop kidney stones as well as septic arthritis. Our nursing problems for our patients with gout is that they'll have pain, impaired mobility, and decreased range of motion. From a treatment standpoint, we can provide them with NSAIDs, which is used both for pain relief, but it can also decrease the concentration of uric acid in the blood. We can also use glucocorticoids, which are aimed to reduce the inflammation, or we can use uric acid lowering agents such as allopurinol and Uloric. From a non-pharmacologic standpoint, we can encourage exercise, splinting of those joints, and diet changes. For example, if we reduce alcohol, red meats, and seafood, they may be less likely to experience a relapse. We know that our nursing intervention has been effective if we've eliminated flare-ups, reduced joint damage, enabled for pain reduction, if the individual has compliance with diet changes and medication compliance. And that wraps up our discussion on gout.